Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now we have chronic papilledema. So the second type is chronic papilledema. In chronic papilledema, there is impaired visual acuity is present. Along with that, the visual field is constricted. Visual acuity is impaired and visual field is constricted in chronic papilledema, and on fundus examination it looks like chimpagne cork appearance or optociliary shunts are seen in chronic papilledema. Then atrophic papilledema. Here the visual acuity is severely impaired because it is the last stage of papilledema, and here even we see secondary optic atrophy is seen in atrophic papilledema. So in atrophic papilledema we have severely impaired visual acuity with secondary optic atrophy.
thank you and thank you for watching.